talk on depression and memory. My name is Lauren Bennett, and I'm a clinical neuropsychologist here with the Pickup Family Institute for Neuroscience. So to begin, I want to say that memory is an integral part of all of our daily lives, memory and thinking. What's not a normal part of our daily lives is two significant fluctuations in mood. So what we know is that everyone has ups and downs in their mood. What the difference is that we don't expect those ups and downs to be deep, deep troughs or high, high highs. But it is normal in step with life circumstances to experience some up and down. Today, we'll talk about distinguishing what those ups and downs should look like and when we should be concerned that perhaps the downs or the ebb and flow of things are too significant. So with that in mind, what I want you to keep in mind is that depression is not a normal part of aging. There's many stereotypes about older adults being more depressive on average, and the research tells us that that's not actually true, that there are many adults that feel quite satisfied with their life looking back, but that there are, of course, depressive episodes in step with those life events that we'll unpack together today. So to begin, what are the symptoms of depression? Well, some of them will sound very familiar. Some of them will sound a bit more unusual. So persistent or sad, anxious feelings, thinking about kind of an empty mood, so feeling like you're unsatisfied, incomplete, in some way unhappy with the quality of your life. Feelings of guilt or hopelessness, certainly the ones that persist longer into your days, across those days into weeks. Decreased energy and interest in activity. So these are activities that you would generally enjoy, things like socializing, hobbies, but perhaps you're not getting as much joy or reward out of those activities as you usually would. Difficulty with sleeping. So this can be too much sleeping or too little sleeping, and this can be both difficulty falling asleep or staying asleep. But the pattern that we'll most often see with depressive symptoms is folks waking up 1 to 2 hours early and not being able to get back to sleep after they've awakened. And then thinking about cognitive symptoms, certainly the most common difficulties we see with depression are difficulties with attention, working memory, so your ability to hold and use information in the moment, and then things slower, with kind of a depression on all of your behavioral activities. And then certainly thoughts of death or suicide, specifically thinking even it would be better off if I weren't here, or I'd rather not wake up tomorrow. All of those are symptoms that would get us concerned about a depressive episode. Now, thinking about how depression might look a little different in older adults, there's some particular symptoms that stand out, again, in the 65 plus age range or somewhere thereabouts. So it might be characterized more by tiredness or fatigue, both physically, emotionally, not feeling like you have quite the same cognitive energy as well. Changes in mood that might be more specific to agitation or irritability, kind of a shorter temper, shorter fuse, so to speak. Confusion, so difficulty tracking things like day and time outside of our retirement, that might be difficult just to track day or time normally, and certainly in this pandemic as well. But more confusion about where you are, who you are, when you are. And then thinking about cognitive symptoms, more difficulty with decision making, again, sustaining attention. So perhaps reading something and having no idea what you read because you weren't quite present in the moment, or realizing that midway through a conversation you're having difficulty sustaining your attention in that conversation. Certainly memory difficulties can be more prevalent in older adults with depressive symptoms. So thinking about more difficulty retaining information that may not be related to a organic neurodegenerative process like Alzheimer's or vascular dementia, but instead more that the depression symptoms are taking up some of our cognitive bandwidth, and so we're having more difficulty recalling that information day to day. There's also often unexplained physical concerns, so things like headaches, more soreness, more pain overall, and then certainly the sleep disturbances that we also described. Again, we're looking for these symptoms that don't necessarily have a medical origin that's easily identifiable. So just to distinguish what might look a little different, depressive symptoms overall might have slightly more of a physical sense in older adults. Now, when we think about risk factors for depression in general across age ranges, there's a few categories I'd like to highlight. The first is genetics. So what we know from the research is that everyone's brain chemistry is a little different. And within our brains, we have different levels of neurotransmitters. There's two neurotransmitters in particular that are very important for sustaining our mood overall. That helps us to stay in a relatively even or kind of content. For some folks, they might have different levels of those neurotransmitters in their brain, and it's the imbalance in those neurotransmitters that's what causes that feelings of depression or anxiety that we were speaking about a moment ago. That's also those same neurotransmitters are where medications for antidepressant medications, where they work as well, so where they can kind of help to balance things out and take the edge off of it. To that same extent, genetics also determine how we respond to any kind of medication or intervention. So some folks, their genetic makeup makes them more susceptible to benefiting from antidepressant medications, while other folks, they might not benefit at the same extent, or they might need to try more medications in order to find one that fits their genetic makeup. The next category is your personal history. So no surprise here, but one big determinant in how likely you are to develop depression, of course, is what happens in your life. So incidents of trauma, abuse, any kind of traumatic event with a family loss, anything along those lines can certainly spur the depressive symptoms to start and then move into a chronic depressive episode after even that acute or immediate phase. The other piece that I want to touch on is lifestyle factors. So what we know from the research, again, is that diet, exercise, and sleep are all directly linked to how likely we are to experience symptoms of depression and anxiety. So when we're thinking about what we can do to better prevent the development or the progression of depressive symptoms, we'll talk here in a moment about what those lifestyle factors are and how we can have the greatest amount of impact with each of those factors. So thinking about the additional factors that might be prevalent for older adults, a few things I want to touch on here. So chronic health conditions. We know that older adults are more likely to experience medical challenges, and along with those medical challenges come many doctor's appointments, increased time focusing on your health and your overall physical well-being. Certainly there's a lot of chronic pain that can come along with that. Medications that might influence those neurotransmitters or interact with our body chemistry in different ways. All of these different pieces can place additional risk for developing symptoms of depression. We also know that obviously as we age, more of our loved ones, our friends, our community will experience other illnesses and will eventually experience some loss of those loved ones. And of course, those losses, that bereavement, can certainly be a risk factor for, again, the initial symptoms of depression that then move into a more chronic, ongoing depression. Certainly, there's also a great deal of loss of independence as we age. So as many of us are used to operating fully independently throughout our day, there's shifts in our financial management, our medication management, our ability to live independently because of both physical and cognitive challenges we might be experiencing. So for many people, that loss of independence, loss of being our ability to drive, our career choice is very important and central to our identity. What we know is that when we lose that piece of our identity through retiring or deciding to transition to a different role or a part-time role, there can be a significant loss of sense of purpose. And that sense of purpose that we carry through our occupations often is not replaced in the same way by the other hobbies or activities that we're able to fill our time with. So certainly a retirement or a loss of professional identity could again be a risk factor for increased depressive symptoms. And finally, we know that depression co-occurs with a number of other illnesses. So when we look at the research, many folks who go on to develop a neurodegenerative disease, like Alzheimer's disease, like Parkinson's disease, often develop symptoms of depression or anxiety about 2 to 3 years before the onset of the cognitive and physical symptoms of that disorder. So certainly the emotional pieces of going through and working with a chronic health condition, fighting cancer, for example, and then also the medication side effects, which we touched on. So when we think about the prevalence of depression in older adults, what we know is that 1 in 4 of older adults at any given time is experiencing symptoms of depression or anxiety. It's a pretty high prevalence rate. About 25% of folks experience depressive and anxiety and anxious symptoms across their older adulthood. It's not uncommon, and if you're experiencing any of the symptoms, you're not alone. This is common, but it can be impacted. We can make a positive impact on these symptoms, and there are things to be done. Just because you're an older adult does not mean that you will experience depressive symptoms, and certainly does not mean that you can't fight them or combat them with these additional factors we'll talk about here. So when we think about depression and dementia, there's an overlap of many of the different cognitive and physical symptoms that I want to touch on here. So the first piece I want to highlight is that folks who experience depressive episodes in midlife, their middle age years, so somewhere between 25 and 45, are actually at an increased risk for developing dementia later on. We don't exactly know why that is, but from our research thus far, we think that there might be neurotransmitter changes or neurochemical changes in our brain that then make it more likely that we'll develop those cognitive symptoms later on in life. I say this not to scare you, but instead to motivate folks to be proactive about their mental health. I encourage you at the first sign and symptom of any of these kinds of emotional changes to really think about how you can combat those symptoms and again be proactive with your medical team to get ahead of those symptoms to minimize your risk of developing any kind of neurocognitive symptoms later on. To touch on the overlapping symptoms, what we know is that there's again these kind of in-between periods when someone first starts to develop symptoms of early Alzheimer's disease, which we call mild cognitive impairment, before it develops into a full cognitive impairment. So when we're thinking about those early changes that might be a precursor to things like Alzheimer's disease or vascular dementia, Parkinson's disease, there are these symptoms that will emerge that might fall into the category of depression. They also might fall into the category of one of these early neurological changes. So things like loss of hobbies or interest. So oftentimes we'll see in folks with both depression and also with dementia patients that they start to not be as interested in all of their hobbies, perhaps engaging with other people in a meaningful way. And again, that's a non-specific symptom at that point. We can't quite distinguish between if it's depression or if it might be a neurocognitive change. Similarly, we'll see that social withdrawal more broadly, just in day-to-day life. Someone who was once the life of the party might be a little bit more withdrawn or introverted in a way that is atypical for them. Along that same line, folks will often isolate, so they won't want to engage as early memory changes, the anxiety that's brought about by being in a social situation, being put on the spot to remember people's names or their hobbies or about their lives. So there's often an isolation that comes in both depression and dementia, as well as apathy. So apathy is essentially not being highly motivated or motivated at all to engage in any kind of meaningful activities that may have been once important to that person. Again, whether that be the social piece, engaging in cognitive activities, interactions at work, any kind of hobby as well. So it's a motivation of sorts, a loss of motivation to engage across these various domains of one's life. And certainly we also see some cognitive implications in both depression and dementia in those early stages. So thinking about difficulty concentrating or staying focused on a task, difficulty returning to a task after they get interrupted, or impaired thinking overall. So difficulty with judgment, decision-making, might be really challenging for the person to even make a simple decision about where they want to go to dinner or which vehicle to buy. They're going to experience more difficulty with those decisions than they would have before either the depression or the dementia process set in. So when we think about our cognitive bandwidth, and I'll tell you what I mean by that. So just like your internet provider at home, we have so much bandwidth for our uploads and downloads on our internet provider, or in our day-to-day life, our ability to process information and our ability to put that information back out into the universe in a meaningful way. And what we know is that depression and anxiety take up some of that cognitive bandwidth. So our speed carrying some of that depression and anxiety burden along that bandwidth panel here. So when we think about the overall symptoms of depression and anxiety, there are many different things that can look similar, but it's all about that reduction in our bandwidth day to day. So you'll see things like memory difficulty. So we're making it to a phone booth, and then dialing the phone number. That's an example of working memory. I'm sure a few of us lost more than a few nickels, imagining pre-COVID times, or who you played golf with 2 weeks before, But we don't get so concerned about those kinds of incidentals, but more significant life events. So perhaps a grandchild's wedding last 6 months ago. Can you remember that? So we'll see those memory difficulties again as a result of the reduction of the cognitive bandwidth. Similarly, we'll see difficulties with attention and concentration. So the example I gave earlier of reading a book but having difficulty really tracking what's going on, perhaps difficulty watching a movie and tracking the plot line or recalling it when you come back to watch the second part the next day. And then difficulty with the decision-making piece and what we call higher-level cognitive functions, things like planning, organizing, sequencing. So if you're planning a large meal, for example, and you're having lots of friends over, can you get all of the dishes out at the same time, keeping them all warm, coordinating what's in the oven, what's on the stove, what's in the microwave, tracking all those pieces and getting them all to the table hot. So the question is, when do we get concerned? As we mentioned earlier, everyone has these ups and downs throughout their life. That's totally normal, particularly when there's a loss of some sort, whether it be a job loss, the loss of a pet, or a loved one. But we do get concerned when symptoms persist beyond expectation, which is a bit of a gray area, of course. What's expectation? Well, again, we think about kind of that 2-week mark for a smaller life event and a several-month mark for a larger life event. So if you've experienced a significant loss and you're still dealing with some of those feelings, it might be helpful to have someone get involved. When is it helpful overall to seek additional support? There's a few kind of target keys that I want to mention here. So if you're having persistent symptoms of depression, what I mean by that is if, again, there was kind of a life event and it's now moved from that acute or immediate phase of 2 to 3 months, and now you're looking at longer term affecting your social functioning, perhaps your occupational functioning if you're still working, or your ability to engage in hobbies or other tasks you used to enjoy. Certainly, if they're impeding any kind of area of your life, we'd get concerned and we'd want to seek some additional support to help resolve those symptoms or help manage them. We would also get concerned if you're concerned or your loved ones are concerned. So if your family member, your partner, your children are coming to you and they're expressing concern about a shift that they've noticed in your mood, that certainly would be a good indicator that it's time to reach out to someone to get some additional support. And finally, if you're noticing any kind of physical symptom changes, behavioral symptom changes, things like disruptions in your sleep pattern or your eating, for example, if you're just eating a lot less or a lot more, finding that you don't have any appetite at all or that you can't be satiated, those are certainly times we'd get concerned that there might be a mood impact happening that's changing those behavioral patterns. Like you might fall into this category where you need additional support. And even if you're not here now, I think this will be helpful information to hold in mind so you can recognize it both in yourself and in your loved ones. So the first step, if you feel like there's more concern, more anxiety, or more worry about any kind of depressive symptoms, is to talk to your medical provider. So your primary care provider is a great place to start, or if you've ever worked with a psychiatrist in the past and you've had some ongoing treatment with that, that would also be an appropriate place to start. The idea here is that some medications can cause these symptoms of depression, like we've talked about, and some medical conditions can also cause that. So your primary care provider, your psychiatrist, whichever medical provider you choose, will do a thorough evaluation to make sure that there's not something else going on, like a chronic health condition, like a imbalance in any of your thyroid functioning, your vitamin levels, anything along those lines that might be impacting your mood. They'll also take a thorough look at your medical history to make sure that all of your medications are working together well, that there's not any side effects that we need to be concerned about with any of those treatments that are already in place. They'll also do a physical exam, make sure that there's nothing concerning with regards to any kind of tumor or other health condition that might be impacting your mood from an organic standpoint. Similarly, they might run some blood tests as well, so they'll get a look at your endocrinologic functioning across all your blood panels, make sure that things are working in the way that they should, and that you're healthy across all of those various factors that can have an impact. If there's not any medical condition, so to speak, that your doctor finds concerning, then they'll talk about some other alternative options. So the next step would be a psychological evaluation, which sounds scary, but is relatively routine. Again, just talking about what might have been going on for you, what symptoms you might have noticed, what life events might have impacted your functioning in terms of your mood and those behavioral symptoms we've talked about. and then they'll recommend a treatment. So the most common treatments are either medication or psychotherapy or a combination of the two. So let's talk a bit about therapy for depression. So this is called psychotherapy or talk therapy. And many folks have this image of lying on a couch and talking about their child. So what we know from the research is that even brief interventions, I'm talking 3 to 5 sessions, can be relatively helpful to target really immediate kind of changes in mood and functioning. Sometimes folks will need additional support, so they might go up towards 10 to 20 sessions that might help resolve kind of larger issues or more ongoing kind of chronic issues in their life. There's 2 treatment modalities that I want to highlight that are the most commonly used to treat symptoms of depression. The first is what's called cognitive behavioral therapy, or CBT for short. And the focus there is on challenging and changing negative thoughts and behaviors that might impact your sense of well-being overall. So you'll work with a therapist one-on-one to talk about those behaviors and those thoughts that are coming in that, again, might be influencing how you're interacting with the world. And you'll work on restructuring or reframing some of those thoughts and behaviors into a healthier, more productive, more balanced sense of well-being that can be inspired by your changing your behaviors and thoughts. The second modality I want to touch on is what's called interpersonal therapy. And this has more of a relationship lens. So it will focus on challenges that you may have encountered in your relationships, whether it be at work or with loved ones or with friends. But it will help you resolve some of those issues that you're experiencing in those relationships, which again might be contributing to some of the symptoms of depression. The other commonly used treatment is medication. So again, what we know from the research is that medication and talk therapy are most successful when they're used in conjunction, meaning that you do both at the same time. But you'll talk with your treatment provider if you feel it's right for you to decide which one would be most helpful. Some folks benefit just from the talk therapy, perhaps if you're not interested in medication, or just from the medication if you're not interested in the therapy. But again, they're most successful when used together. So when we think about antidepressants, a few things I want to highlight here. There are many different types of antidepressants, and the truth is we don't fully understand how each of them work as of yet. But we're getting a better understanding each year with our additional research. The reason I highlight that is that there are many different neurotransmitters or neurochemicals in our brain that these different medications work on. And it's not a one-size-fits-all. We have a general list of medications that are most efficacious or most beneficial for the majority of people, but you may have to try multiple medications to find the one that fits best for you. Just like my favorite pair of shoes might not be your favorite pair of shoes or may not be comfortable to you at all, same thing, you have to try on a few before you find the right one that fits. So if you try a medication and it's not the right fit for you, I would ask that you stay as hopeful and resilient and gritty as possible as you try out a few different options with your treatment provider to find the shoe that best fits for you, because it will make a significant difference in the long-term effects. What we also want to highlight, though, is that it will take 8 or so weeks for most of these medications to take their full effect or to have the full range of benefits. So often folks will see benefits in some of the physical symptoms like sleep and the appetite issues earlier in the course of medications before they see the low mood improving. So do not, as best you can, try not to judge those medications before they've had the full 2 months or so to really take the full effect. For many folks, you'll see any kind of side effects. If there's nausea or any kind of GI symptoms, you'll generally see those around 3 weeks. So we do want to hear if you're having any of those difficulties, because it might be time at that point to try a different antidepressant medication. But to see the full benefits of the medication, please do give it the full 2 months to work. The other thing I want to highlight about antidepressants is that it's incredibly important that you don't stop taking them without notifying your doctor and looping them into that conversation. So there can be a really negative side effects, both in terms of your mood functioning and your physical functioning, like there's any need to adjust the medication dose or to try a different medication. Generally, most folks find benefit from being on antidepressants for somewhere between 6 months and a year. So we're not talking forever, but these are supports that we can use in these more challenging moments of our life, which I know many folks are having a lot of difficulty, particularly with the pandemic right now. So that's a great example of when these might be helpful. but these are meant to be supports for shorter term period. So I don't want anyone to think that they're going to end up on medication for several years unless that's beneficial to you and you decide to stay on it. But sometimes there can be a significant resetting of the neurotransmitters or neurochemicals even after 6 months. So we see the benefit even if you decide to discontinue the medication as kind of a reset, or turning the computer off when it's not working right and giving it a few seconds before you turn it back on. What we did highlight a moment ago, and I just want to make very clear, is that you will see withdrawal symptoms if you decide to discontinue the medication, which is why it's really important to work closely with your provider to loop them in and keep an ongoing dialogue about what you're noticing whenever you do decide to stop the medication. The other important fact is, like we said, there will be some side effects for a number of people, and it's very important to have that conversation with your provider about the side effects that you're noticing. It's not normal to have GI side effects. It does happen in a percentage of people, but do be sure to have that conversation because there's lots of other options that you can trial if that's not the right medication fit for you. It's also important to let your doctor know all of the other medications that you're on, because many antidepressants can have adverse side effects or interactions with other medications you might be on. So be sure and bring a full list of all of your medications and supplements to your provider for that discussion about which medication or which antidepressant might be best for you. It's also important to note that there are some herbal treatments. One that gets a lot of press is actually St. John's wort. So it can have really negative effects with antidepressant medications. So it's very important to also include on that list of medications that you're going to take to your provider any of your supplements or herbal treatments that you might be taking. What we know from the research is that our lifestyle factors of depressive symptoms. So what are those lifestyle factors? Sleep is a big one. Sleep is implicated in just about every chronic illness, both emotionally, physically, that you could imagine. So everything from cancer to Alzheimer's disease, there's a huge impact on how we sleep. So good quality and good quantity sleep are highly important for your well-being overall. If you're having any difficulties in those areas, we have a wonderful sleep clinic here at Hoag. You can Google sleep clinic and Hoag to find out more. The other lifestyle factors that are very important are exercise, so making sure you're getting that 30 minutes of exercise 5 times a week, of brisk aerobic exercise, quick walking, swimming, cycling, whatever you... I'm sure you've heard this before, but what we know from the research is that that exercise has an incredible effect on our serotonin levels and our dopamine levels. Again, those neurotransmitters that are very important for stabilizing our mood across time. So they can have an incredibly positive effect, particularly when used in conjunction with antidepressant medications and talk therapy. Similarly, our social connections are highly important, good diet, and purposeful activities. So finding things like volunteering where you're able, making meaningful connections in your community will be very important. And then finally, if you're both your talk therapist, your provider, your primary care provider, or your psychiatrist early, because that's where we can have the biggest treatment effect, is if we catch these things early. And I'll leave you here just with a few additional resources. So there's general resources for calling both in Orange County and at the national level that will be in the slides. If you're experiencing any suicidal thoughts, there's a resource there for the National Suicide Prevention Lifeline. Also offerings for substance abuse. Both are doing online counseling at this point as well. And some additional resources for intimate partner violence or domestic violence, and some COVID-specific resources from our NAMI Orange County friends. And of course, if you suspect any changes in memory or mood, do follow up with your medical provider. And you're also welcome to come see us at the Orange County Vital Brain Program for a memory assessment where we can further tease apart what might be related to your mood changes and what might be an organic memory change. Any questions?
Quick question. If my doctor put me on antidepressants, then how would he know when to take them, or would they know when to take me off?
It's an excellent question. So the question is, if your doctor put you on antidepressant medications, when would they know to take you off? And the response is that you're going to have to be an advocate for your care here. So it's very important to continue an ongoing conversation with your prescribing provider to let them know how you're doing on the medication, if there needs to be any adjustments to the dosage, either titrating up or down, Or if you feel like your mood has stabilized and you'd like to try to take yourself off of that medication, then working in conjunction with your provider to step down. So reach out to your provider, make sure that they're aware of any concerns that you have, or if you want to start the conversation about when it's time to come off, that would be the first stop.
No other questions.
Great. Well, thanks so much for joining us. Be well and